Then almost all biological reactions are carried out under the catalytic influence of enzymes. Enzymes are nothing but proteins. Now, these enzymes can either be stimulated or inhibited, and there are two drug mechanisms which come under these enzymes. One is enzyme stimulation, second one is enzyme inhibition. We will be discussing enzyme inhibition. So there are two types of enzyme inhibitors, reversible and irreversible. Reversible enzyme inhibitors block the enzyme activity or inactivate the enzyme activity through non-covalent binding, which results in reversible interactions, whereas irreversible enzyme inhibitors blocks the enzyme activity or inactivates the enzyme activity by binding covalently to a particular group at the active site of the enzyme. Example, organophosphates. Now, coming to the reversible enzyme inhibitors, these are subdivided into three types: competitive inhibition, non-competitive inhibition, and uncompetitive inhibition. The following are the examples given. Competitive inhibition inhibitory drugs include methotrexate. Non-competitive inhibitory drug is ibuprofen, example, and uncompetitive hydrazine. Then let's first discuss about competitive inhibition. Competitive enzyme inhibition is a type of inhibition where one complex is formed, and this complex is results due to the competition which occurred between the enzyme inhibitor and the substrate. So basically, we know that substrate binds to the active site of the enzyme, but over here what happens is the enzyme inhibitor competes with the substrate to bind to the active site of the enzyme. So instead of enzyme substrate complex, we get enzyme inhibitor complex under competitive inhibition. So in competitive inhibition, only one complex is formed, which is enzyme inhibitor complex, which is used to block or inactivate the activity of the enzyme. Here the Vmax remains unchanged, constant, and the Km value increases. Example for this is donepezil. Donepezil is given for the treatment of Alzheimer's. Basically, donepezil acts as a acetylcholine esterase inhibitor. Acetylcholine esterase breaks down acetylcholine, which is a neurotransmitter, but donepezil inhibits the activity of acetylcholine esterase, resulting in increased synthesis of acetylcholine to treat the Alzheimer's patients. This does not treat the disease completely, but it slows the speed of disease onset. Then coming to the mechanism of competitive inhibition, there's competition between, as I said, there's competition between the substrate and the enzyme inhibitor, where the enzyme inhibitor wins, and there is no binding of enzyme, substrate, but there is binding of enzyme inhibitor, which results in enzyme inhibitor complex. So over here, enzyme inhibitor is there, substrate is there, which compete with each other, and finally enzyme inhibitor binds to the active site of the enzyme to form enzyme inhibitor complex, EI complex. Coming to non-competitive inhibition, as the name suggests, there is no competition between the substrate and the enzyme inhibitor. Over here, what happens is two complexes are formed: enzyme substrate complex 1 and enzyme substrate complex and enzyme substrate inhibitor complex. So what happens over here is that the enzyme inhibitor binds to the enzyme substrate complex. So there are two different sites. There are like the substrate binds to one site of the enzyme, and the enzyme inhibitor binds to some other site of the enzyme. So these substrate and enzyme inhibitors bind to different sites of the enzyme, forming both enzyme substrate complex as well as enzyme substrate inhibitor complex. This is usually said to be the combination of both competitive and uncompetitive inhibition. Here the Vmax decreases and Km remains unchanged. Example for this is ibuprofen. which is a non-stimulatory anti-inflammatory drug used to treat inflammation, pain, and it acts as a non-competitive inhibitor of HPEPT1. Then coming to the mechanism, there's enzyme inhibitor, and then there's enzyme in substrate complex. So this is enzyme substrate complex, and then there's enzyme inhibitor, and which results in the formation of enzyme substrate inhibitor complex. But there are different sites for binding. The substrate binds at different site of the enzyme, and the enzyme inhibitor binds at different site of the enzyme. And then coming to the comparison, competitive has only one complex, which is enzyme inhibitor complex. Non-competitive has two complexes, enzyme substrate complex and enzyme substrate inhibitor complex. In competitive, there is competition between substrate and enzyme inhibitor. In non-competitive, there is no competition. And yes, then this is the mechanism. Comes uncompetitive inhibition. In uncompetitive inhibition, there is formation of one complex, which is enzyme substrate inhibitor complex. It is similar to non-competitive inhibition, but the difference is that the site for binding of both substrate and enzyme inhibitor is the same when compared to non-competitive, where the sites for binding of substrate and inhibitor are different. Here, there's obviously no competition between enzyme and substrate. The sites are different. The enzyme inhibitor binds to the enzyme substrate complex, resulting in the formation of enzyme substrate inhibitor complex. Here, both Km and Vmax are decreased. Then the example for this is hydrazine, which inhibits aryl sulfatase. Coming to the mechanism, there's enzyme inhibitor, there's an enzyme substrate complex, and this enzyme inhibitor binds to the enzyme substrate complex at the same site, resulting in the formation of enzyme substrate inhibitor complex. Same site for binding. And then coming to the differences, in uncompetitive, there is same site for binding. In non-competitive, different sites. In competitive, there's competition between substrate and inhibitor. Competitive EI complex, non-competitive ES and ESI complex, uncompetitive ESI complex. These are the differences. Then the Lineweaver-Burke plots for inhibition, the graph is plotted to determine the Km and Vmax. That is how we figured out if Vmax and Km decrease or remain unchanged or increase in all the three types of inhibition.